have Liane Jollon, Director of San Juan Basin Public Health. First question I want to ask you, are you getting any sleep?
Sleep? Never heard of it.
Thank you for taking the time to be with us today for AIDS and Issues. So I will turn it over to you.
I'm making sure, is my screen shared?
Not yet.
Okay, hang on one second, sorry.
No problem.
Share screen. Okay, let's try that again.
There we go.
All right, and then I need to.
Looks like you are up and running.
Okay, so the first thing I'm going to do is just thank everybody here and everybody across La Plata County. These have been incredibly difficult times for all of us. I appreciate Jack asking if we've been getting any sleep, but I think we can ask that to everybody in this room. This is a very, very difficult and stressful time. We are dealing with a lot of unknowns, and we do like to remind people that, you know, global pandemics are certainly less than once in a lifetime events, and the economic and social and educational fallout from this event is more than any of us could have imagined working through. So we're all in the same boat of too much to do in too few hours. So we are committed to getting the community back to normal as safely and as quickly as possible, and that is the challenge with a burden of disease and infection that is unknown, and a brand new virus where we're still learning things every day about how it is transmitted and what the best ways to contain it are. So this community has done a fantastic job of staying healthy. There has been tremendous commitment to social distancing, and that is, you know, wearing face coverings, maintaining 6-foot distance from other humans, keeping, you know, our hygiene, washing our hands, sanitizing public spaces. All of that together helps us limit spread of disease. But then what we need to do is get the spread of disease down to a manageable amount where we can contain cases rather than continue with very difficult social distancing, which is what we're here to address today. So our current data, and I'm sure people are aware of this, this is up on our website. We update it daily. Commissioner Church referred to a workplace outbreak in his talk a few minutes ago, and I just want to be clear that there were 5 new cases in a workplace. Only 1 is a resident of La Plata County. 4 of the workplace cases are residents from other locations. Anyway, so our data up here is that we have had 81 cases in La Plata and Archuleta County, with 58 recovered. We've had 11 hospitalizations. As Mike Murphy has discussed in our Mercy presentation, San Juan Basin Public Health and Mercy Regional Medical Center have been working closely to track resources in the community. And then as far as testing goes, we have had almost 5,000 tests since this began here. So what we know in that data that we're showing about over 25,000 cases across the state of Colorado, because the testing was limited through the beginning of this pandemic and remains limited, the guess is that Colorado has had about 170,000 cases. So there's only a small percentage that are lab confirmed at this point. Let's see what. And this is just a summary of what San Juan Basin Public Health's role in this event are. We have been tracking COVID-19 since January. We were meeting internally. By February, we were meeting externally to work on community plans around how we would contain it if necessary. By February, we had done tabletop exercises and exercised our roles in testing, isolation, contact tracing, and quarantine. PPE, I think everyone has, before this event, did not know what PPE stood for. I think all of us now know it's personal protective equipment. It is had been in short supply for a lot of this pandemic. We are still working to increase supply chains locally, statewide, and nationally, because we cannot contain a contagious disease without personal protective equipment for healthcare workers, and now find needs to have PPE in other industries that have not had familiarity with using PPE before. Emergency management is the mechanism in which we do this. COVID communications, I think you all are familiar with our website and the information that we're putting out. And then business, workplace, restaurant self-certification. That is the measure that we have put in locally, so that as businesses and workplaces receive new guidance from the state, there's a bit of a pause button to make sure that everyone is able to access their guidance, understand what the ask is for that business to operate safely, find out what the equipment, additional resources that would be necessary, and what it's going to take to train staff. And so this way, as businesses operate, we can help everyone understand and limit spread of infection, keep their staff safe, and keep their patrons safe, which we know is important to everybody. And so hot off the press is where the state is in studying mobility data now that we are bringing businesses back online and changing guidance about how often people should be staying home and what activities we can participate in. So through this time period, we're finding that the mobility data is mostly tracked in the Front Range. There is some statewide mobility data. This is kind of anonymous aggregated data from people's cell phones that indicate how much time people are spending at home and how much time people are going out. And so we are finding that there was at some point a significant peak of how many hours people were spending home, which is where they're least likely to spread infection. Now that we are opening the economy and bringing things back to normal, we're of course seeing that people are spending more time outdoors or out of their homes. The question is if we can spend our time outdoors and spend our time in businesses that have adequate protection in place, we can sort of shift into spending less time at home and not spreading infection. So that's what we're trying to do as the public health community, is provide guidance for that. The modeling projections for the state of Colorado are that at our peak of stay at home, we had about 85%, an 85% reduction in contacts that could transmit disease. We still need to keep that at a pretty high rate. 65% is where we need to keep it to remain in the low risk category for overwhelming healthcare. So in the presentation that Mike Murphy showed, when he says we're at low risk, that is assuming that we are still maintaining social distance. So we need to continue to maintain social distance at about 65%. We're also asking people that are in more high risk categories to further limit their interactions and chances for spreading infection. One of the bottom end of that is that if we open everything up at once and only have a social interactions limited by 45%, where the models will change and we will see modeling predict a surge in excess of hospital capacity by midsummer. So that's our wiggle room. It's in between 45% and 65%, and that's what we're working on, is getting the guidance out, following the guidance, opening businesses, but knowing that we still have to maintain the social distancing. And we also are getting new evidence all the time that mask wearing does limit spread of infection. So the more that we wear masks, the more that we can bring on new activities for the community. This slide here is just an indication of the mobility data, and as you can see from the first slide to the second slide, we're showing as we're adding in another week of data, it is more steep, our declining hours at home. So again, this is a combination of opening things up, weather getting better, people needing to, get out and return to normal. And so the trick is, how do we do this without spreading infection? So this is a demonstration of the data we're looking at. The other thing that's really important to know is who's most at risk, and this is why we're stratifying recommendations for older adults and individuals with serious underlying medical conditions. We know that those individuals are more at risk, so there will be kind of stratified guidance, and that is what this slide shows, is that, as I think many of us know, age is a factor for COVID-19. As of this week, we are getting new executive orders from, we got new executive orders from the governor's office on Monday around the next amendments to the executive order for safer at home. And that does then sort of stratify that high risk people over 60 with underlying conditions are still in stay at home. And then the new safer at home guidance does more outdoor recreation activities. I know there's been questions in the chat about that. And then it comes out with new guidance for houses of worship, personal recreation, and then some updates to some other businesses. All of that is in draft form until tomorrow. Feedback, public comment was collected until noon today, and then the new public health orders that go with the executive order that came out on Monday will be finalized tomorrow. I know people are very anxious for that. We, of course, will get out the information as soon as we can. Here's some details on it. I put some of these links into the chat for people that are asking for it. We can make sure that everyone gets it. And that is, I don't know how much time I have, I'm sure I'm over. So all I just want to say is, thank you to everybody. We really appreciate the work the community has done to flatten the curve. It is all of us. There's no one agency that is successful in this. We are successful in flattening the curve together. We will be successful in taking the next steps to new normal together if we all kind of learn what our responsibilities are and do it. We need to get the economy back open, all of us do, and limiting spread of infection is going to be the best thing for all of us. And we will continue to remind people, wear your face coverings, wash your hands well, avoid contact with people who are sick, don't go out if you are sick, wash things more frequently. Excellent, I like your face covering. And then lastly, go in for testing. If we go in for testing, we'll be able to know where infections are and stop them in their tracks. Thank you.
Thank you, Liane. And you did say was that you like me better with my face covering, or no? You like the face covering.
I got you. Face coverings are. There's all kinds of people that you're not sure if you recognize when you're out now. I like that one.
I'm just glad to see you laugh. So thank you for all your hard work with everything you've been doing, and everybody at San Juan Basin Public Health and the information that you're dispersing. I know Claire and Tracy I've been in contact with regularly. So thank you so much.
Thank you.
I've been trying to answer some of the questions in the Q&A, but if you do have them, a question, please again go back into the Q&A and ask. And